The long-term effects of concussions are getting more attention among pro athletes.
Even children can experience more than just temporary dizziness and confusion. WRAL's Dr. Alan Mask tells us concussions can cause lasting vision problems.
10-year-old Ian Turner jumps from one sport to the other throughout the year. Last fall, his Pop Warner football team was in a championship game with Turner pitching long snaps back to the quarterback.
I looked between my legs and the guy rammed into my head a couple times.
And Ian went up to his coaches and said he wasn't feeling too well.
He felt dizzy and his eyes were sensitive to the sun. He was also seeing double. Ian had a concussion. Ian initially saw his family doctor, who referred him to a neurologist. That exam apparently revealed a vestibular component, which means it affected movement and balance, including the vision.
Not every concussion has a visual component to it, but most actually do.
Ian came to optometrist Dr. Michael Peters, who's also team eye doctor of the Carolina Hurricanes hockey team. He says vision problems resulting from a concussion may resolve on their own or linger for months or longer.
And what happens with the visual concussion is that the brain shuts down in that area, and then like a computer, when it reboots, it just doesn't reboot the right way.
He uses different vision exercises, many of which can be practiced at home. Ian also wore special corrective glasses for 2 months.
My eyes started to hurt a little, but after like a week or two, my eyes felt normal.
It took a lot of effort on his part, but he was motivated.
Because he knew the quicker he could recover, he could get back out onto the basketball court to be with his new basketball team.
Dr. Alan Mask, WRAL Help Team.
He's a busy kid. Dr. Peters says most visual concussions will correct themselves on their own, but he says vision therapy can cut the recovery time in half. Dr. Mask says if you or your child suffers a concussion, see a medical doctor first.
Athletes